Hey everyone, and welcome back to the live stream. We are here today. We're going to talk about all things medical coding careers. We're going to talk about ebooks, very hot topic right now. We're going to talk about any changes with the exam, if we've heard anything. We're going to talk about different credentialing organizations, where to get training, certifications, what's going on. Happy Monday. But yeah, say hi to your friends in the chat. Grab your favorite beverage. I actually don't have coffee right now. I have iced tea, and my circle bottle, because we can't just have one drink. There's a minimum 2-drink minimum in this live stream. So let's get started and get into today's live stream. Hey everyone, happy Monday. Getting some catch up done with the channel lately. I've been having I don't know about you guys, but I think I have woken up every day this month and been like, oh my gosh, I'm about to get sick. Like I'm about to get a cold or the flu or something. And I don't. I just feel like yucky every single day. So I've been struggling kind of catching up on stuff because I've just been feeling kind of like blah, but not getting like full blown sick. But this week, I should be having 2 videos coming up, which I'm excited about. One is to help out my preppy students because they start their training with the PMIC CPT book. So one video is specifically going to go through that version of the ebook. And I think I have another that's something about, I think, CPC exam tips or something like that. I don't know. I've been feeling so frantic lately on topics because there's certain topics that perform certain well, but then I feel like I also have to cover coding topics, but then I kind of blank on the coding topics. You know, my specialty is most things skin, so plastic surgery, dermatology, wound care, but then also E&M, like all things E&M. So I don't know if I should just cover E&M cases. What really seems to be doing well is CPC exam prep stuff. So I don't know. Let me know what you guys think as far as like, do you want me to start covering more how to code certain stuff, or do you want me to cover something else? Hold on, how do I get back to my comments? There we go. I can't see my comments, right? I got to move them over. There we go. So hello, everyone. We got a lot of people coming in today. We got Beth from Alabama. We got Dallas coming in. Jacqueline, say hello, everyone. Excited to be here today. Dorothy Edwards says, hey, Victoria and everyone. I've been looking for some free resources of practice exercises. I don't and can't afford membership. I tried AAPC and just coding and they want memberships. Yeah, so there's really not a lot of free resources available for practice exercises, at least not that are appropriately licensed. But because of the licensing agreements with CPT, it's kind of hard to find free resources that are available. Short of, Googling and finding old practice exams and stuff. Sometimes you can find those like on a little bit of a sketchy websites, I'll say, and you can find like downloadable old CPC practice exams in PDFs. One that I do know of off the top of my head is I know cco.us has a free practice exam. I think it's one that you need to subscribe to their email list perhaps to get, but let me see if I can bring it up. Let's see if we go into Google. Oh, I didn't want to hit that button. Where are my layouts? Let me share my screen and see if we can both navigate through to it together. Okay. So if I'm over here in Google, cco.us free CPC exam. Yeah, here we go. So that's what you would get into Google. Free CPC practice exam with cco.us, but I believe you do have to sign up for their email list and they do have a free 50-question practice exam that you can access. So that's what I would recommend. I like cco.us. If I ever have a specialty that I'm like, I kind of need some training for this, or I want to, I don't know, brush up on something, I really like their little blitz courses and stuff that they have. They're a good organization to go through. Yeah, Sarah says E&M. I definitely need to start working on getting some E&M cases together. So I have a question coming in from Instagram. Says, I passed my test in December and I'm not sure how to move forward on finding a job. How do I look about those? So what I would recommend is I actually, since I get so many requests for job stuff, I made a whole playlist that's at the beginning of the channel. So if you go to the main channel page, there's a lot of resources there. So like how to look for a job, information from recruiters, how to go through interviews. So it is over here. If you are looking for a medical coding job, here's all my best advice. So how to find your first job, how to get hired, mock interviews, some LinkedIn tutorials, and that's all my job seeking advice. Yeah, Sarah says she thinks Tiffany Roach, the coding coach, might have some free resources on practice stuff too. Karen Davis says, is there such a thing as NHA courses for CPC? So NHA is a different organization. There's only one organization that you can get the CPC from, and that is the AAPC. There's other organizations that you can get training to sit for the CPC exam from. So you could go to directly from AAPC, you could go to a community college, you could go to a tech school, you could go to a licensed instructor, you could go through all types of different programs that will prepare you for the CPC exam. But the only place that is allowed to administer the CPC exam is the AAPC because they're the ones that have the authority over that. This question here on Instagram says, does it help if you have medical experience but not in coding? Somewhat, yeah, because at least then you have that baseline experience of potentially things like working with medical insurance, maybe some medical terminology. You know how the structure of healthcare kind of works, the different components that are involved. And if you have anything where you're like working with ICD-10-CM or CPT, that's what they're looking for with things like the apprenticeship removal for the AAPC. They're looking not that your title is medical coder, but they're looking for, did you do something where you're working with codes, working with ICD-10-CM codes, even doing things like calling in for prior authorizations where you're working with those codes and stuff. So any kind of medical experience is definitely helpful. Some of the best coders that I've hired have been people who worked elsewhere in healthcare and not even at clinical roles, people that were doing scheduling. I think one really awesome coder that I had was working somewhere within the ER, just doing, more kind of almost administrative type of work. Beth says, I've taken the CPC exam 3 times. I plan on taking it again soon, but I need help. So a couple of resources that I have available. I do have some things that are available for free on the channel. So again, I love playlists. So I love organizing entire playlists for like the things that are very, very common that I get a lot of requests for. So how do I find a job? How do I get started in medical coding? I need help with evaluation and management. Exam tips and stuff. So I have exam tips, but then I also have a CPC review that is available for free. If you haven't, though, already gotten the practice exams from the AAPC website, those are probably my favorite practice resource because they do mimic the actual exam. So you can work on things like your timing. You can work on things like, okay, I need to flag questions and I can work through those. Those are really helpful as well. You can also check with your local chapters. They've been doing a lot more review classes as well. So you can check to see if there's any local chapters near you that are having review classes or ones that are just coming up from others. Sometimes you can get them for pretty cheap, like $25, and it's like a 4-hour class. Um, and yeah, they do them for a variety of the credentials now. I actually got the email the other day asking if I would like to be on the list of instructors to host review classes, but I don't know. Maybe if I talk to someone at HealthCon, because I always feel a little funny about signing some of the contractual things. Like, I feel like in the instructor stuff that they sent out, they're like, well, don't reuse these materials for basically your own personal sales, which I'm fine with. But also, I plan on developing some other materials that are not their materials, but also CPC prep materials. So I don't want to step on any toes there. Thea says, I'm enrolled with Preppy right now. Would I be able to buy the practice exams now or after I finish the exam program? You can buy them at any point in time, but you only have access to them, I believe, for a year. So if you were interested in buying the AAPC practice exams, let's see, they are on the AAPC website. Prepare for your certification exam. This should be here. Prepare. There's so many things you have to scroll through. Why would it not be there? Oh yeah, prepare for the exam. CPC. Exam review, practice exams. There we go. So you can buy the practice exams on the AAPC website. I think you have access to them for a year. I wonder if it's in the terms and conditions. It could be 6 months. It could be a year. I'm feeling a year. Yeah, so don't quote me on that. But yeah, the bundles, if you're interested in buying the AAPC practice exams and you're not sure which bundle is better, there really isn't one that is like inherently better than the other. One's just as good as the other. It's not like, oh, well, if you buy this bundle, those have more questions that are on the actual exam. None of these questions that are on these practice exams are going to be in the exam bank that they're pulling your questions for the actual exam, but you might find something that's like very similar. So there might be like a question on your practice exam where they're like, hey, here's a case where the patient is having a 2-centimeter lesion removed from the right arm. And then the exam bank, you might get a question that has a 3-centimeter lesion that's removed from the left leg. So kind of similar concepts. They're trying to figure out if you can code for that same sort of series, but not the exact same question. Sharon says, how can I get into scheduling? I would just look for positions in your local healthcare institutions, taking a look at what surgical centers, hospitals, healthcare institutions are near you, and then just go through their job listings and see if there's anything available in the scheduling department. Scheduling's not usually one where they require much experience, maybe like a high school diploma or GED. But he's asking, what is the difference between the CBCS and the CPC? So the CPC and the CBCS are not equivalent. When most employers are looking to hire medical coders, they want a certification through AAPC, like the CPC, or through a HEMA, like the CCS. For billing positions, a CBCS is fine. But if you're looking to get a job specifically in medical coding, they want those coding credentials through AAPC or a HEMA. There are some pockets of areas geographically where they might accept a CBCS for a coding position, but not a lot. So unless you're in one of those areas where there's an organization near you that will take the CBCS for coding, generally you need a certification through AAPC or a HEMA. With the CBCS, I think a lot of training institutions, colleges, tech schools out there, they have some sort of almost like partnership agreement where they're like, "Hey, we will give your students a free exam test through for the CBCS if you do X, Y, and Z with us." Um, or they'll give them like a very discounted rate for those college institutions to purchase them. But they're good. The NHA, the CBCS, they're good, they're fine. But as far as getting employed in medical coding, they're not as widely accepted by employers. Yanokam says the practice exams expire for a year. But yeah, if you want to buy the AAPC practice exams, they are cheaper, I believe, if you're an AAPC member. So they're $80 if you're a member. They're $210 almost if you are a non-member. I'm curious if they're having any other bundles right now. They're always running some kind of special on the AAPC website. So let's see what they got right now. Book bundles. 4 days left for training membership books. And then that's just their webinar lineup for February. I like to add on the webinar subscription when I renew my membership for the AAPC because they usually give it to you for a really, really good discount. The other thing is sometimes if you look out around the holidays when it's like Black Friday deals and stuff, they'll do their webinar subscriptions there as well. I like having it because I have a few specialty certifications, and if you have multiple credentials with the AAPC, you need to get more CEUs. They cap it at a certain amount. I think it's like 56 or something like that. So if you get 20 different certifications, you still only have that cap of the amount of CEUs that you have due. But I have a couple that are specialty, so I need CEUs that are approved specifically for those specialties, and plastics and derm tend to be the hard ones, especially plastics because it was sunset, I guess, several years ago, but I still have to get CEUs to keep that credential. But I think I like having the webinars because there's just such a variety of topics available, and I can get them on demand then, and that makes them like super, super easy to do. So if I'm like short a couple specialty CEUs, I can go and just scroll through the on-demand webinars and see what'll apply. And I'm actually going to HealthCon this year, which is coming up faster than than you would think. I think we're only 6 weeks away, something like that, maybe 5, 6 weeks. And if you've never been to HealthCon, they're having it this year at Coronado Springs, which is Disney's moderate resort that has more of a luxury feel to it. The tower that they have at Coronado Springs is new. It is absolutely, it is absolutely gorgeous. And they have a lot of food choices over at Coronado Springs. And I think as part of the registration, they are giving one free Twilight ticket Tuesday night to Walt Disney World. If you're ever interested in going to like an AAPC conference, be it a national or regional, and you want your employer to pay for it, that's a conversation that you need to start probably having now to maybe do next year, or even now to have. I think the next one's in California for regionals in October. So that's a conversation that you should be having way in advance if you want to go to an AAPC conference, because they need to put that into the budget. So if they've already allocated everything for the budget this year, they can't go, okay, well, we'll approve you to go to a $900 conference. But if you start looking ahead and going, you know what, I'm going to be taking on all these different specialties, or I can bring back this information, or I really want to develop into a leadership role, or I am in a leadership role, at budget time, really start tapping into your employers and going, hey, you know what, I think this conference here, RevCon or HealthCon, or even the virtual HealthCon, you need to start having those conversations way in advance. But yeah, I'm excited. I'm very anal, so I go through on the app and I look through all the attendees and I start taking notes on like who I want to meet up with while I'm there and who I might want to do like video interviews with and all kinds of stuff. So I'm starting to plan out my outfits. I'm excited about that. But yeah, it's going to be a good event. A really good variety of speakers this year. Really excited about that. A lot of good topics. And yeah, it's going to be awesome. I have a question here on Instagram that says, do you work for AAPC? I do not work for AAPC, and my statements do not represent the AAPC or its company. I have worked in volunteer capacities for the AAPC in the past. I've worked on the chapter advisory board for, that was a few years back that I ended my term. I've worked as a volunteer for the chapters as chapter officers. I have done a couple of content creation things for AAPC. I did an exam video for them. I did a HealthCon promo video for them, but I'm not employed by the AAPC. A question coming in on Instagram: what questions are more based for the board exam, please? So the AAPC certification exam for the CPC is not really a board exam. There's no official licensing for medical coders. There's no database of medical coders. It's really not a board exam. It's a certification exam, like getting Microsoft certified. But if you're interested in what questions are on the exam, let's kind of take a look here. I believe it's here on taking the exam. All the way at the bottom is where they have the exam breakdown. The AAPC website anymore is one of those ones where you're like, if I can't find something, I need to start scrolling, because the pages sometimes are just very, very long, and you think things are not there, but it's because you're not scrolling all the way to the bottom. So I have to even remind myself that as I'm going through, I'm like, did I scroll all the way through the bottom of this page to make sure I looked at everything, just to verify if it's there or not? But the CPC exam has 100 multiple choice questions. In order to pass, you need to get 70 questions correct. Each question is worth 1 point. There is no questions that are worth extra points or anything like that. Each question is 1 point, regardless of if it is a 2-page operative report or if it's just asking you some sort of midterm question. As far as midterm, there's 4 questions there: 4 on anatomy, 3 compliance and regulatory, 7 questions on coding guidelines, 5 questions on ICD-10-CM. Now, that does not mean that there aren't other questions that are going to test you on ICD-10-CM. It just means that there are 5 questions that are exclusively ICD-10-CM. All they're asking you about is ICD-10-CM questions. But there might be other stuff in there that touches on ICD-10-CM. Same thing with HCPCS. There's going to be 3 questions where all they're testing you on is a HCPCS codes. But there might be some cases and things where they're also going to ask you about a HCPCS code. There's a lot of it is CPT. The CPC exam is very, very heavy CPT. So 6 questions each on the 10, 20, 30, 40, 50, 60, radiology, path and lab, medicine, E&M, and then just 4 questions on anesthesia. And then 10 cases. And what the cases are, they're kind of like notes. So it might be an E&M note, it might be a progress note, it might be a consult, and they're going to say, hey, here's this case, and they're going to ask you 1 question each on each of these 10 cases. And it could be a combination of CPT, ICD-10-CM, and HCPCS. Now, there is talk that at some point these cases might become fill in the blank. Currently, they are multiple choice. There is no date as far as when, if they might possibly turn into fill in the blank, and it will be informed way, 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 way in advance. It's not going to be like, oh, hey, I have my CPC exam scheduled next week, and suddenly they're going to go, oh, ha ha, because it's going to be fill in the blank next week. They're going to let you know well, well, well in advance before they make that switch over. I honestly, I'm feeling good confidence that it might not even happen this year, because there's been some commentary even from the AAPC that they kind of put it in the back burner. So there's a big exam bank. There's over 1,000 questions of questions in this bank for the CPC exam, and it's electronic. So you'll be randomized. You'll get a random 100 questions, but they're going to pick them all out from 6 from medicine, 6 from E&M. Make sure that they're all kind of the same difficulty level for each examinee. So there's no telling what questions you're going to get on the CPC exam, because it's very randomized. So this isn't an exam where you can can kind of effectively cheat your way through or memorize questions, because there's just so many possible combinations of questions anymore that it's really more so the concepts that they're testing you on and understanding the concepts. Fatima says, Preppy does not give the books by the AAPC. Do I need to purchase AAPC books when taking the CPC exam? If you want to use the print books, you will need to get the AMA edition of the CPT book. You can use ebooks, and that will not be at any additional cost for you. If you take the exam, they will be embedded in. So let me go through a couple of, let's see if I have them here. So when you're since January, you've been allowed to use ebooks for the CPC exam. They are not the ebooks that you personally own. They are not the ones that you would get from a company like Preppy. They are embedded in the exam platform. And I'll show you what I mean by that. So the AAPC has a video available where they talk about this, so you can get a feel for kind of what it looks like. I'm going to mute this real quick, and I'll share my screen here. So what happens is, if you are someone who has the wrong books, outdated books, you don't want to purchase books, or you just like electronic books, you can elect, when you redeem your exam voucher, to use either your physical print books, which means you have to bring your proper versions of the printed books, or you can use ebooks. Those ebooks, they do not have any additional cost beyond that of what you have for the exam voucher. And they will be embedded in the exam platform. So once you go in and you take your exam, they will be popped out. So you will get into your exam platform, just like they show here in the AAPC video, this official one. I recommend everyone reference this if you can. I have an ebook video on the channel that covers all of this. But basically what it'll do is they'll have your question over here on the left-hand side, and then over on the right-hand side, the ebooks will be embedded, and you can look at both of them at the same time, or you can also pop them out. And then you also have the ability to like split screen, search, and use all kinds of different tools and things as you're taking that with the exam. So again, if you're someone who has outdated books, because maybe you studied medical coding in 2023 and then you had some life experiences that got thrown in your way, either a sick parent or a sick child, or someone lost a job or whatever happened, and you're like, oh, I'm ready to get back into this, but I don't really want to spend an extra $250, $300 on books. You can become a member of the AAPC, pay for your exam voucher, and select to use the ebooks. And then those ebooks will be embedded in the exam platform when you log in to take the exam. Kim's asking, is there anyone you know that has a channel for medical coding from the consumer perspective? This would be along the lines of patient as consumer empowerment. I do not. I think I attempted one video like that once, and it really didn't perform very well. And I honestly, I don't connect with a lot of other creators in this same sphere, not because I have any kind of emotions that, it's me against them, or, I'm up here and they're down here, or I don't like what they do. I just don't. I've had instances in the past where I've looked at other creators and, they say comparison is the thief of joy, and I would pass judgments on them, and that wasn't fair to them. It wasn't fair to me. And honestly, like, my interests aren't all medical coding. So a lot of the free time that I have, I'm not just like consuming other medical coding content. I'm reading books and at dance class and doing all kinds of other stuff. So yeah, I honestly just I don't know what other creators are doing. Every now and then I'll get, I don't want to say dragged into something, maybe made aware of things. Like one time I had someone that was like, oh, that's so funny, I just did a video on the same topic. And I kind of got the impression they were almost insinuating that I like stole the topic idea from them. And I'm like, I never watched your channel. I couldn't tell you what topics you're covering right now. Lulu says, I noticed the study guide is like a course in itself. Thanks for going over the benchmark on what questions to expect for the exam. I have last year's books. Is it best to have current year? If we're talking about the code books themselves. So when you're sitting for the exams, you have to use either the current calendar year or one calendar year prior. If you're talking about as far as prep materials, like if you're looking at the CPC training manual or the step-by-step books, 98% of that is going to be the same from year to year. The only change we've had that was really drastic recently was like when we changed evaluation and management codes. Um, but as far as the lookup process, how medical coding works, that's all the same. And even the code sets themselves, I think we had a very minimal amount of code changes this year. I think it was maybe like 4%, 5%. So typically having a 1-year outdated book isn't going to be a huge make or break. But there are people out there who have used 1-year older code books and then maybe didn't pass and then felt regretful about it. So it's a personal kind of choice to weigh between like, okay, do I want to spend for those extra code books for the updated year that I may or may not use again past the certification exam if my employer buys me books or I don't get a job for a little bit or what have you. Yeah, so it's a personal choice. And honestly, yeah, the study guide for the CPC exam from the AAPC is basically an abridged version of the CPC training manual. So I've gone through some of the training books versus the study guides, like page by page, and you can tell that they just like took some paragraphs out or shortened some things or maybe paraphrased some things. So it's very much just an abridged version of the training manual. I have a question here. Do you personally prefer to code inpatient or outpatient and why? I actually don't code inpatient. I code professional fee, outpatient, and risk adjustment. I actually don't know PCS coding. Hikari says, when will ICD-11 get into the U.S. healthcare coding? So here's the thing. We don't know. We have no planning for it. There's no discussions about bringing ICD-11. So we're talking at this point, it's not even in the planning stages. So years, likely years. I know there is talk about ICD-11. Other countries may already be using ICD-11, may have made the switch over. But we're not even on the spectrum yet of considering that in the US healthcare system. Now, I know there are places and educators out there that are already educating on ICD-11, and I don't think it's a bad idea to start learning about some of the essentials of it. However, I practice what my friend Pat Flynn calls just-in-time learning, which means that I need to focus on learning things right now that I need just in time for the next thing that I'm doing or the thing after that, not things that are potentially going to happen years from now. So if I were to dedicate all of my time, or you were to dedicate all of your time right now to mastering ICD-11 coding, and then we don't go to ICD-11 until 7 years, well, in 7 years from now, you're going to have to relearn all of that because you'll probably forget it in that span of time, right? So I think right now there's better things to focus on mastering in medical coding versus getting so far ahead on ICD-11, unless you're planning on working for organizations outside of the US that are already on ICD-11, or you want to be like the utmost trainer in ICD-11 when that potentially happens here. Natasha says, do you have any tips for how to remember the most important guidelines for different kinds of cases? So I personally am not a fan of memorization of the guidelines. There are probably very few medical coding guidelines that I actually have memorized, but it's important to go through things like the ICD-10-CM guidelines and read through them again. And maybe like once a year when we're doing our updates, give them a skim through again. Um, there's not like one component is much more important than another. All of it kind of is important depending on what you're coding. If you're coding a lot of inpatient stuffs or inpatient pro fee hospitalist, I guess we'll say, sepsis is going to be a lot more important of coding guidelines than it would be for the OB coding guidelines. If you're working OB, then you're going to need to know a lot more about the OB coding guidelines. Those are going to be your priority. So depending on what you're doing, what you're preparing for, what specialty you're working in, certain guidelines might be more important than others, but none of them are really inherently more important than others. It really is a process of just getting more familiar with the guidelines, understanding some of the guidelines, not just in ICD-10-CM, but those beginning ones in CPT. And getting familiar enough so that if you get a case, you're like, I know there's a guideline about this and I know where to find it. So that's really the key. Beth is asking, will you have new videos on the new 2025 codes? I do for ICD-10-CM. I don't cover new CPT codes only because of the licensing there. And I feel it would be overstepping just a smidge to cover every single new CPT code. Kim says, I was under the impression that we are going to learn ICD-11 within the next year or two. Yeah, you don't know how to relieve Diane to say not to expect it for several years. Yeah, I haven't heard anything. So my friends that I've talked to, they've not heard anything like that we're planning to move to ICD-11. There will be an announcement. When we moved from ICD-9 to ICD-10, there were announcements from the government, from CMS. They're the one that has to really kind of guide us through that. So until you hear from the Centers for Medicare and Medicaid Services, like this is the date that we're planning to switch to ICD-11, I wouldn't worry too much about it. I think some of these places that are really pushing ICD-11 are doing it because they want you to buy their webinars, and no hate to them. Like, hey, I like selling content as well and making money and so forth. But yeah, I think a lot of the ICD-11 is either just like, hey, don't panic, like here's what it is, or like, hey, we want you to panic and buy our thing. Jane says non-ICD-11, I think offer classes to manage AI system on coding. So here's my thoughts on AI. I feel like this is like EMRs. Like unless it's a I have so many things I can say about AI. But I don't think there's really any courses that are general about AI that are going to give you an edge in medical coding at this point. I think what employers will start looking for as far as, ooh, this person's going to be better than this person for this AI aspect is that if you are trained on a program that they are using. And I'm not sure that we're really there just yet. But on that topic, I have had so many people, so many people reaching out lately. And a lot of them are programmers and such. And just it's getting to the point where it's like multiple times a week now, where they're like, hey, we watched your channel and we noticed that you're using books. And we don't know if you know this, but there's these amazing technology called AI. And you dummies still using paper books don't know about that. But I'm going to come in because I'm a programmer and I'm super smart and I'm going to make AI medical coding. And you can you help me look at this and make sure it works, blah, blah, blah. And I'm like, look, if you don't think that 3M and Epic have been on top of this for years, you got another thing coming. And healthcare is a lot more complicated than a lot of people think it is. And not to say that I'm sure there's programs out there that are phenomenal, and I actually have some people that I do want to reach out about programs that they've developed and stuff. But it's funny how it's almost become this gold rush that people are like, oh, I've discovered this untapped place here in medical coding, and I'm going to be the one that's going to come in and fix it. And I'm like, you and a lot of other people. Whew, okay. Cynthia says, is there an app for quick reference for MedTerm? If so, what would you recommend? Google. I'm going to be honest with you. That's what most medical coders are using. They're just Googling things. If you come across a term or a body organ or system or something that you're not familiar with, most people, I think, are just Googling it. And even in work, that's what we do. If we're looking at a case and there's some kind of new surgical system or something that we're looking at and we're like, I don't know what the heck that is. What is the XPS 24? We just Google it and do a little bit of research there. D. Jenny says, if I do not have the 2025 books for ICD-10 and CPT, what can you recommend I study from the 2024 books to take the 2025 exam? So you are still permitted to take the exam with the 2024 books. If you can get a hold of listed updated codes, like you can write those into your books. Um, let's see. Sorry, I'm short circuiting here for a second. Running out of breath. Uh, yeah, so you can still use your 2024 books in 2025, but there's obviously been some code changes since then. The chance that one of those tiny percentage of codes that have changed from 2024 to 2025 are going to appear on one of the questions that are in the code bank and then land on your exam is like a fraction of a percentage of a chance. So if you have 2024 books and you want to use the 2024 books, you can. The other thing you can think about is you can also opt to use the ebooks. So if you don't want to pay for 2025 books, but you still want to use the 2025 books, when you take your exam, you can opt to use the ebooks, and those ebooks will for 2025 will automatically be embedded in your exam platform when you take for the exam. The process of medical coding has not changed at all from 2024 to 2025. So however you were going to study in 2024, exact same things and processes you would study for 2025. Macy says, as a complete newbie and beginner, I'm seriously looking into starting the Preppy program. How difficult is it to learn and understand for someone like me with zero experience? So I came into this with zero experience in healthcare. This was years ago, way, way before Preppy existed. So I went through my local community college. I went to classes in person way back in the day. So this is very doable for someone who has zero healthcare experience. If you're not familiar with Preppy, I want to talk about that real quick. Hold on. So if you're not familiar with Preppy, that's the program that I recommend, that I partner with, and they provide medical coding training to my viewers who are interested in getting into a training program. And I do want to disclose that I do receive payments from Preppy in relationship to promoting them. So if you don't like that, I do have other recommendations for you that don't pay me. So just hold on one second. But if you are looking for the program that I recommend, that they take care of my viewers, they have externships. If you pay in full, will give you a Chromebook. They have great student support. Everything's online, flexible, budget friendly. You don't have to worry about student loan debt. You can find out more about Preppy over at medicalcodingmasterclass.com. You can also go to preppy.org and find out more information there. And they're great programs because they give you everything you need. You sign up, you pay, you have access. It's all online. So if you're someone who drops off your kids in the morning and you have a little bit of time before you start your job, you can study then. You can study on your phone at the car pickup line. You can study in the evening after you put your kids to bed. If you have break time during work, you can study then. So it's very, very flexible online again. However, if you're like, hey, Victoria, I don't trust you because I know you're getting money from Preppy, that's fine. You don't have to go with Preppy if you don't want. So there are other training options. If you're looking into this, is check your community colleges. You might get a workforce improvement grant. You might be able to get something online there as well, where they can cover things that that you might not find covered elsewhere. Check with your employer, see if they have any kind of reimbursement for certain programs through certain local organizations. So sometimes they have tuition reimbursement through certain organizations. You could get a job somewhere at maybe like your local hospital, and oftentimes they will train you for other healthcare positions at certain online schools for a discounted amount or even for free. You can also go directly from the AAPC. Like if you're like, I don't know, understand all these things going on. You can honestly just go directly through the AAPC website, look for all their certifications and decide, you know what, I want to become a certified professional coder, and they will give you the whole prep training. They'll sign you up for either your self-paced, or you can get an instructor led where you meet with someone weekly via Zoom and go over all kinds of class questions and stuff. That of course is going to cost you more because the more bells and whistles you're getting, the more you have to pay for. But yeah, you can do it directly through that as well. So lots of different options out there. Oh, I clicked on my How many books have I gotten now? See, here's my ICD-10 PCS book. I heard this one from Ahima is really good, so I got the ebook version because I'm still convincing myself. Every month I'm like, starting this month, gonna learn PCS coding. Still haven't. Still haven't. Ma'am asks, I read Preppy accepts students for outside the US. How and where can they take the CPC exam? So there are international testing centers for the CPC exam. You would have to check AAPC Global to find out where near you that might be. Lulu says, is Preppy more focused on medical coding only? It is a medical billing and coding training course. It prepares you for billing jobs. It prepares you if you want to take the CBCS or the CPC. I would recommend getting the CPC. And it does count for the 80 contact hours for your apprenticeship removal for the CPC certification. So if you glitched again. So if you want to sit for your CPC certification, you would buy Preppy. You would have to then get your AAPC membership and then pay for your exam fee. Those are the two extra costs you will have if you sign up with Preppy. So you would still have to be, if you want to get a CPC, you still have to pay for your AAPC membership and the exam fee. And that will help remove your apprenticeship status because it counts for the 80 contact hours. So if you are someone who has no experience working with medical codes and you take your CPC, you will be automatically designated an apprentice coder. There's a couple of ways to fast track getting that apprenticeship status removed. Typically, the old-fashioned way to do it is you have to get 2 years of experience. There's a couple of things that will count each for removal of 1 year. So if you do what's called Practicode, which is the AAPC's program that you purchase that gives you like mock coding cases that you have to code from scratch. And if you complete all those modules, it'll take 1 year off. The other thing that will take a year off is if you do 80 contact hours of medical coding education through a school or through the AAPC or through a program like Preppy that can give you a transcript or some sort of official documentation saying that you completed 80 hours of training. And Preppy does count for that. Ooh, here's a good question. I have a question on Instagram that says, can you recommend training for the CPMA? So I'm going to give you 3 options depending on what you like. Number 1 is if you want it right from the horse's mouth, you can go directly from the AAPC and get CPMA training there. Now, if you're pretty good, like you've done medical coding for a while or you've done a little bit of auditing, you could probably get away with just buying like practice exams and a study guide type thing. The other thing is cco.us has a really good program for this. So their course here, medical coding, I know it's in here somewhere. Physician-based, HCC, advanced medical coding. Come on, where is it? Maybe it's under their blitzes. Oh, do they not have it anymore? Maybe they took it down. I hope not. Course. Let's take a look. Inpatient, advanced medical coding. Maybe they don't do auditing anymore. Uh-oh. Physician-based medical coding. Maybe they don't. Maybe they took off theirs. Okay, so the other net recommendation that I would have would be NAMUS. And they have training for the CPMA. And they do, I think, like weekend boot camps and stuff for it. So CPMA prep. And I really like NAMUS. They do really good, really thorough education. So that would be my other recommendation as well. Macy says, there's no other option for me besides Preppy personally considering the price. I'm just nervous to pay that amount and not know first if it's something I could handle. So they do have that money back guarantee. So if you wind up starting it and finding out that it's something that you don't like, you do have a money back guarantee there available. Nina says, "Hi, studying for the CPC. Your videos are great." Nina, let me tell you, if you are studying for your CPC and you have concepts that you're like, "Oh, this is really tough," or "Oh, my classmates are also having trouble with this," drop me a comment on a video in my community somewhere and let me know, because I love to have videos that are helpful specifically for people who are struggling with certain topics. Do I know how long the preppy externships usually are? Off the top of my head, I don't. If you contact help@preppy.org, they should be able to give you a better idea. May says, "I'm currently taking medical terminology classes to complete medical billing and coding. Due to health reasons, I would only be able to work part-time. Is billing or coding better to work part-time?" I mean, it depends on whatever you can find. There's not obviously as many part-time positions as there are full-time ones, which I think is true of almost any industry or any type of job. There is a lot of contract work. So if you're someone who is able to work maybe a 6-month contract part-time, you might have some better opportunity finding some positions there as well. But yeah, there are part-time positions available. But let's even take a look over here. Let's see if I can find something on like LinkedIn as far as kind of the differences between part-time, full-time. Let's see, jobs. Now, if you're kind of new to my career search tactics, job search tactics, is I like to say just search for ICD-10, because that's going to pull up billing and coding adjacent types of jobs, things where they're looking for someone with these code skill sets, but might not necessarily have the specific title of medical coding or medical billing. But you can break it down, I think. Experience level, salary, company. Let's see if they have one for part-time or full-time. Yeah, so part-time is definitely gonna cut down some of our results there. So we do have PRN, part-time, physician radiologist, speech and language, PRN. So yeah, there's definitely part-time positions out there, just not quite as robust as the full-time positions. Lulu says, "To be honest, Preppy seems more economical and offers more features than most online courses." Honestly, they do. And I'm going to tell you, their customer service is phenomenal. Occasionally, like, I will see someone in my comments and they're like, "Oh, I'm having such and such issue with Preppy," and I like panic and I'll email them and they'll be like, "Oh yeah, we've already this is so and so. We contacted them 3 times. We're going to contact them again." Or it'll be like, "Oh, we contacted them right now and we got this all settled. Don't worry, it's all taken care of." And I'm like, "Oh, okay." Like, they were so on top of it. It's crazy. And yeah, so everything's what you need to understand too about Preppy, and I want to make sure I emphasize this, is that they are an online, flexible, budget-friendly option. If you're looking for something where you want instructor-led, or you want to meet with someone once a week, or you want super fast 24/7 support, that's going to come at an additional price. That's not going to be a budget-friendly option, right? But uh, I think the AAPC, like their instructor-led program, if you want to add on all their additional stuff, is usually like $5,000 until you add everything on. Preppy still comes out like so affordable. So if we go to preppy.org and we see their certifications, medical billing and coding, they have the pricing, like, it's super transparent. The pricing is all here. It's under get access now. So yeah, the pricing information is all there, very transparent. So even if you add on the cost of that EAPC membership and the cost of the certification exam, it still comes out cheaper. And remember, you're going to train in Preppy with ebooks, but you can also take the CPC exam with ebooks embedded in, not the same exact ebooks, but with ebooks embedded in the exam platform. So if you use the ebooks, that's all you would need to pay for, is that AAPC membership and the exam fee if you want to go for the CPC afterwards. Not everyone does, because again, this is a general kind of billing and coding program. So some people, if you just want to get into billing, you'll get your nice certificate of completion from Preppy. You can sign up for an externship and you can do that and go get a billing job. If you want to go get into medical coding, I would suggest getting the CPC, which means you have to be an AAPC member and pay for that exam fee. If you want to use paper books, though, you may have to incur some costs for some of the paper books because there's certain editions of the CPT book that you have to use. Hikari says, is Indeed safe to use for job search? You know what? I had something come up recently that was acting really crazy with me. I don't know that it was Indeed though. But yeah, Indeed, I've always had good luck using the Indeed website. So let's see here. If I'm looking for a job, again, ICD-10, it'll come up with, yeah, a lot of stuff. Or if you want to switch this over to remote, so it's not in your exact location, you can do that as well. So if I'm looking for a job that's remote and I'm looking for something that deals with medical codes, type in ICD-10-CM, see all the different stuff that comes up. So we've got surgical trauma coder, oncology. Sometimes you can find jobs in working in like cancer registries and tumor registries. They love people that have coding experience, love them. So yeah, I think if you look for different code sets, it'll help you get a wider variety of positions, and you can filter. Now, this isn't foolproof, but a lot of these positions, a lot of these career platforms like Indeed, like LinkedIn, you can filter down to experience level and do things like no experience required or entry level. And again, it's not foolproof because it depends on who was inputting this and if they input it correctly. But a lot of times you can find a little bit more of a narrow scope by using some of those filters. The question here, how much math is involved in billing? Not a lot. We're talking like basic elementary kind of level math. So you might have something where you are billing a medication and it's 10 milliliters and you have a patient that received 50 milliliters. So you need to look at the billing units and how much was administered and figure out how many billing units you're going to bill for based off of how much was administered and what the billing dosage is for that code. You might have things like there's a lot of skin stuff where there might be some math. So skin grafts and skin replacement surgery and skin excisions and transfers are often based on things like square centimeters. So you need to know that if you are dealing with a lesion that you're removing and it's going to be a skin graft that is 5 by 5. So how do you calculate the square centimeters? Well, you take 5 times 5 is 25, but then the billing unit might not be 25, it might be 20. So you have to calculate, okay, well, how many units then am I billing out of that? But nothing super crazy. We're talking basic arithmetic stuff. So multiplication, division, addition, subtraction. Miss Nolda's asking, don't you need another certification to be a tumor registrar? I am not entirely certain. I think there are different certifications out there, but I think there are sometimes, at least from what I've heard, I've sat on presentations in regards to tumor registry positions, and they said that they like people that have coding experience. I have a question on Instagram. Would you have any recommendations for the CRC if I wanted to get that certification before my CPC? If you want to get that before your CPC, I would recommend going through the full training program through like the AAPC because it's easier to sit for your CRC if you already have your CPC. But if you're training specifically for your CRC first, that could be a little bit more difficult because you have to have a very masterful level of ICD-10-CM training. So I would really recommend just maybe going directly through the AAPC for CRC training. Now, if anyone's interested in becoming a CRC and you're already a CPC or you're already working in billing and coding and you have that baseline knowledge of ICD-10-CM and you have a baseline knowledge of health insurance and stuff, I do have my website course on the CRC. So right now my library is a little slim. I just have my risk adjustment course and my E&M course. Both of these you can get, I believe, 25% off with code No, what code did I recently develop? Hold on. I just made a new code for my YouTubers. Where was it? Hold on. I don't want you guys to see the back end stuff. But I do have a CRC course, and that is good for the CRC, or if you want to go to the RAC credential through HEMA, it's good for that as well. So it's kind of like a general risk adjustment stuff, but also preps for the CRC credential. And that course that I have is kind of an abridged course. It's like an accelerated course where we skip the basics of ICD-10-CM and really get into like, what do you need to know for the CRC exam? And I do have a discount code, but let me just make sure I'm giving you guys the right one. Authenticator. So the coupon I have right now, yeah, I still have a 50% off coupon. And I think that's good for all of my courses, YouTube 50. So that'll take 50% off if you want to buy either the E&M course or the risk adjustment course. So YouTube 50 is 50% off. Nina says, can you have your books tabbed when you take the exam? Yes. Someone actually recently reached out to me, and I don't know if they misinterpreted something that they were told by customer service. But if we look at what's allowed in your books, but someone messaged me and they're like, I was told that I'm not allowed to bring my own books. They're going to supply them for me. And I'm like, well, I don't know how that's going to work if you're taking a remote proctored exam, because you'll be in your house and there's no one to supply books to you. But let's take a look at what it says, because I always like to reference back to the official AAPC guidance. So, AAPC, what's allowed in our books? So handwritten notes are welcome in your coding books as long as they relate to daily coding activities. Please note that notes from the study guides, practice exam, or the exam questions are not permitted. Tabs may be inserted, taped, pasted, glued, or stapled in the manuals. Just be sure the tabs are used to highlight important pages with words or numbers rather than supplementing information in the book. To ensure the integrity of the materials, we kindly ask that you avoid altering pages in your coding book, such as marketing pages, table of contents, or reference pages. This helps maintain the original format of the book. If the use of ebooks is selected for the exam, you will have access to a shared library of the necessary references. Personal notes and tabs won't be available. You can rely on the clean format of the ebook for your exam, along with the search function to find necessary information. So yeah, you can definitely have your tabs in your book as long as they are not supplementing information in the book. They're just clearly there to serve as some sort of bookmark and show that, this is my cardiology section, this is my alphabetic index. Not that you're pasting a whole extra sheet or a post-it note or something in there to write tons of extra information. And this is the last question I'll be taking for this live stream. I notice I have both the CPC and CRC. The required CEUs did not change. Is this due to anything specific, or it might not have updated? I believe they've changed it, I think, a little bit over the years, but if I remember correctly, the CPC and the CRC, because they are both core credentials, what they do is they have certain educational opportunities that are approved for CEUs for any core credential. So the CRC, I don't think breaks out because it's considered part of those core credentials, which is the same for me. I think if I get anything that's approved for core credential, it might count towards the CPC, the CRC, possibly even the CPMA. Let me see how mine looks these days. Membership. Where is my AAPC? Here we go. Where's my tracker? Certifications and CEUs. Let's make sure I'm not showing any CEUs here. Yeah, okay. So, yeah, so because it's considered a core credential, they're all bundled together, the CPC and the CRC. So mine, I have CPC, COC, and CRC. So anything that's approved for core credentials applies to basically all of those core credentials. And I don't think it increases necessarily the amount of CEUs that are due. Yeah. Yeah, it's more so the specialty credentials, things like family practice or OBGYN and stuff that they're looking for different types of CEUs for. Anyway, thank you guys so much for coming in. I will be back next week for the live stream. Yeah, new videos coming this week. Very excited. Keep an eye out on the website to see if there's any new offerings coming. Still working on it. Still working on it. I'll see you guys soon. And until then, just keep on coding on.